are you okay starting the meeting off? Is that okay?
Yes.
Well, thank you everyone for joining us. My name is Kate Jones. I'm the Chief Exec at Healthwatch Rochdale, and you are here for our April board meeting. Margaret, our chair, is having some IT difficulties in getting back in, so I'm going to pass over to our Vice Chair, Ben, who's just going to start the meeting off until Margaret is able to get back in. Thank you, Ben.
Yes, welcome everyone. Do we normally have a round of introductions for the YouTube channel? Do you think that's a good idea? Yeah, okay. I'll kick off. I'm Ben Greenwood and I'm Vice Chair, and I will go round this way. So Claire.
Hi, my name's Claire Birch and I'm the Information and Communications Coordinator at Healthwatch Rochdale.
Mel.
Hi, I'm Melanie Tunney. I'm a volunteer board member at Healthwatch Rochdale.
Naomi.
Hi everyone, I'm Naomi Burke. I'm the Engagement and Volunteer Manager at Healthwatch Rochdale, and also I'm the Lead Officer for Youthwatch Rochdale.
Right, and last but not least, David.
Hello, David Bradshaw, and I'm the Treasurer of Healthwatch Rochdale.
Okay, excellent. So that's the introductions. Any apologies other than obviously Margaret's difficulty? Don't think there is any. Okay, on to the next item, which is questions from the public. And my notes say there's none have been received.
So just to come in there, Ben, we've had no formal questions relating to the Healthwatch Rochdale operational running. However, we did receive a letter into the board, but it was more on a personal case perspective, so it's not something we're going to discuss in the public domain. However, we can reassure the board that Margaret's had oversight of the response and it's been dealt with, but it wasn't appropriate for the public board.
Okay, thank you. Okay, on to item 3, approve the previous minutes. I'm taking them as read. So is everyone happy with those?
Yeah.
Yeah, excellent. Now on to the action log. So it's Kate, over to you.
There's no recorded action from previous board meetings, so there's no action log to pick up at this meeting, Ben.
Okay, thank you. We're zipping through this agenda. Item 5, matters arising. I don't think there's any matters arising. No. And item 6, declarations of interest. Does anyone need to declare an interest for this meeting?
No.
No.
No. Excellent. Right. Okay. On to item 7 and the strategy refresh paper. And Kate, you are going to take us through this.
Hopefully you can all see that page being shared on your screen. So this is a refresh of our strategy. This is the one-page document. There's the full strategy to be created on the back of this. So just to take you through our journey in regards to our strategy, our previous strategy was obviously from 20 to 23. There's not much changes within the strategy itself because our core vision and our core work doesn't change. You know, we've got our statutory functions. We've been through 2 stages of engagement, phase 1 and phase 2 on the strategy. The first phase was with staff, board and volunteers within the organisation. The second stage was with the public and professionals of the Rochdale Borough. Our vision, mission and our values have changed slightly upon that consultation. So our vision is now reading as improve health and social care experience for everyone in Haywood, Middleton and Rochdale. So across our strategy, what we are trying to do is we used to just be under the Rochdale Borough. That's how we sort of like advertise ourselves. But in line with our local NHS commissioning services, we've decided to break that down into the Haywood, Middleton and Rochdale area. As part of the consultation phase, it was highlighted that people would like to see the Pennines on there as well as a descriptive area of the Rochdale Borough. However, Healthwatch England did contact us and I had a meeting with the North Lead of Healthwatch England, and they raised concerns around using the word the Pennines because obviously the Pennines cross-boundary, not just for Rochdale, but in Lancashire and further south as well. So what they was concerned about was the confusion to say that we're the voice of the Pennines when actually it's the Rochdale Borough specifically. So with that in mind, there was a decision to actually remove the Pennines from the document and just stick in line with the local NHS commissioning name as Haywood, Middleton and Rochdale. So our mission, we are the independent voice of Haywood, Middleton and Rochdale residents. We listen, challenge and shape local health and social care services. And then our values are pretty similar. The main one that's changed there is around cooperative. And I think the fact that Rochdale is a cooperative borough, and you know, a lot of the work that we do, we have a cooperative engagement plan, and the hospital and the Northern Care Alliance really focus on that cooperative approach as part of that Rochdale setup. So that's been the main change there. Moving on to our strategic objectives. So really, you know, our key 4 areas of what we want to do, and obviously our key bread and butter is seeking the views of and experiences of that, and how we're going to do that, and the challenges and the tactics in which we'll do that as well are all identified on the document. Just to take you down to the pink box at the bottom, how we will do this is really just to highlight through insight, our branding, through partnership working, through new digital innovation and current digital work, by monitoring our impact and by looking at people and money and how we spend. That's how we hope to deliver the full strategy. So it's really about the insight, making sure that our research is in depth and we understand our communities, and we're working with partners to ensure that. And it's really about highlighting the role of Healthwatch Rochdale and raising that awareness, and we do that through the branding. Our branding is, you know, is quite unique, and we're really keen to push that out. So that's our strategy, a bit of an update in regards to how we've gone about changing it and the public consultation that we have gone through. So I'm looking to seek approval on the new document, please.
Thanks, Kate, and just a big thank you for all the hard work been put into this. It's always difficult to develop any strategy for any organisation, especially health and those involved in health and care. So thank you very much for Kate. Any questions from the board? Mel.
Thanks, Ben. It's not a question really. It's just a comment. I think it looks good, and I think it is good to be able to do a condensed version, because not everybody wants to plough through the whole document, and you know, it tells the story and what Healthwatch are doing. So that I really like it.
Excellent. Good. So if there's any more, no more comments, should we all agree to, as a board, to approve this strategy? Yeah, excellent. Brilliant. So that has been approved.
Thank you very much.
Okay. Give me a second.
The strategy can be delivered with the funds that are being provided by Rochdale Council, can it?
Yeah, in line with our strategy functions and the requirements of the tender. That's how it's been written. We have our core statutory functions, and that's what's been pulled out to deliver that strategy at that high level.
Good. Yeah. So next is business plan. Business plan 23-24, and this is a paper which everyone I take has read, but if Kate, you can just give a very brief summary and ask us what we need to agree on it.
Yep, so the business plan is a high-level strategic document which, so in regards to our strategic plan, which obviously has been signed off. So the changes obviously in the document are key around our vision. Sorry, that's my dog. Our mission, our vision, and our values. So that's been updated within the document. We've amended the document slightly, sorry, and I'm whizzing through to highlight our outcome measures. Now, previously, what we used to have was an external work plan, which would really highlight our statutory functions in line with our outcome measures, and we would report on that. But that's not a document that's really required within the system. So we're doing this through the business plan now. So the outcome measures really describe how we want, what we want to achieve by doing some of these key work areas. Altogether, there's 9 outcome measures that are within the document. Obviously, strategic objectives have now just been approved in line with that one-page strategic plan. So the strategic objectives are the key sort of top lines as part of the business plan. So taking you through the objectives, you've got the key objective which is highlighted in pink, and then the area of work as to how we're going to deliver in that particular area. So as we go down, just to give you some examples, so area of work is gathering the service user feedback. And the deliverable there is community engagement feedback action plan. We have 4 engagement plans looking at seldom heard engagement around raising awareness of our organisation, and and they're all in that operational level. The action there will be to develop a plan to engage with residents, which we've got, and then the outcome measure will be back up at the top of that table under outcome 8 and ensuring that the patient's voice is heard. So the delivery time is to start from May, and then obviously the completion time is March. RAD rating throughout the whole of the business plan is green, and we are confident in regards to the delivery of the business plan, and then the ownership of who the lead officer sits within that. As you go through the document, like I said, the objectives are highlighted in pink. So there's various ways in which we will seek, for example, seeking views of the seldom heard voice. It states how we're going to do that and how that outcome measure will come through to you guys. But as a whole, the document has been updated to really identify what's key in regards to our strategic aims, but also in regards to the changes within the health and social care environment and us as an organisation around governance and our charitable status, and our aim to change that over this year. So that's a quick whiz through it. But like I said, this is a working document for us. There's been key changes made within this document. However, it is something that we want to build up and develop on as part of that strategic plan, business plan, and our operational workings, and how we look at our KPI and reporting, both to the board for assurances and to the local authority.
Okay, thank you. Any questions from board members, please? Yeah, and I think it's quite a very thorough, document. We've got some chat coming through. Margaret asked it. Okay, yeah. So yeah, thank you for presenting that, Kate. Any questions from the board before I put it to the vote? No. Again, as I say, thank you to the staff for pulling it together. Everyone happy with that? Mel, David?
Yeah.
Yeah, excellent. Fantastic. Right, so that has been agreed. So the next one is the work plan. Is that correct, Kate? The next item?
Yeah.
Okay. And that's you again.
I'll bring it up now. Stopping that barking. We're on the work plan. Okay, so hopefully you can all see that document now.
Yep.
This document has obviously been pulled from a larger work plan document, but it's really just top level work in regards to what we aim to do. On the back of that, it's that continuous strategic plan, business plan, and then how we are operationally going to deliver on these work areas. Really breaks down, the key line areas of work. For example, with our governance, we've got the strategy refresh, which is we can now tick off, and there's a time frame and a Gantt chart side to the document, which will be coming through to board for reassurances on reporting. It really does highlight our key things that we want to achieve over the next 12 months in regards to governance. Come down into various sections. So we've got governance, engagement, communications, our volunteers, our youth watch, our advisory group work, and then I think I said communications already, actually, sorry, and our reporting about how we're going to externally report and make sure that the residents' voice is fed into the health and social care system and wider. That's the document at a top level. Like I said, this will be brought through to the board for reporting, but it identify what we're committing to as an organisation. For example, around our youth watch, We're going to deliver that Youth Watch. We're setting monthly meetings, and that's our aim. We're going to look at partnership working. We're saying that we're going to do quarterly Youth Watch 100 surveys, and we want to be looking at recruiting one per month. And obviously that's our reporting mechanism into the board there. So it really is the finer detail, and like there's more work plans underneath this document, but it's really to bring it into the public domain to show our transparency about how we're going to deliver on our contract this year, and also seek approval from the board.
Thank you. Any questions, comments from the board, please?
I'm just wondering, if we're saying that things aren't complete, could that be about progress instead of saying incomplete? Because some of those things aren't even due to be completed because they're quarterly documents. Like, for example, the one that you just mentioned, Kate, that could be ticked off. I don't know whether that's just my thoughts, but it just more says where we are rather than that they're not done. Because some of them are done, but it's because they're not due to be done, if you get my drift. Yeah,
and so what I've done with this document, I've almost pulled it from the Excel. So actually, if you saw the Gantt chart at the side of it, you'd actually see on the Gantt chart it's blacked out when it's not required. But yeah, I take on board what you said. I think we do need to think about it's not that it's incomplete, and I think there's almost a key that needs to go with this. So, for example, if we're on track with stuff, if anything's falling behind, we will have some sort of colour-coded key for you to be able to recognise that as board members as quick reading on the reporting process.
Yeah,
that sounds good.
Is that okay? Yeah.
Excellent. Yeah, some kind of rag rating, red, amber, and green. Brilliant. Okay, everyone happy with that?
Yeah.
Excellent. Now on to the. I realise this is quite a lot of papers to get through, but it's our first of the new municipal year. So meeting matrix 23-24. Is the purpose of this paper, Kate, to get nominations for the meetings, or is that a process that we do after? Because there's a few meetings on there I can possibly put my name forward for. Is that the purpose of the paper, or is it just a general?
The purpose sorry, as a statutory, within our statutory functions, there's certain meetings that we have to attend. So what we're identifying here is where we're fitting within the health and social care arena. Some of them are statutory meetings that we have to go to. Others it's really just trying to fit in line with what our work plan areas are, really encompassing that seldom heard engagement type stuff. So it's really just to give you guys as a board and also the public an idea of where we sit, where we're scrutinising, where we're engaging with stakeholders, and how we're delivering that functionality of the business. I think there's a separate conversation which I'd really appreciate as to who's attending those meetings and what support our volunteers within the business can offer.
Yeah,
so it's really for more information, but really to show that we are hitting where we need to be hitting and give you that reassurance.
Okay, no, that's brilliant. I suppose for a future one, perhaps we sort of divide them into these are the statutory ones and these are the ones, but that's something we can work on. But it's a lot of meetings, isn't it, for us, for a small organisation? But they're all very important.
Yeah, there is a lot, and I think as an operational team, obviously our capacities with Rob left the business in March, so it's something that we do have to manage. What we've really tried to look at is where we can feed in our insight and our data, rather than just being a person around the table. It's what we get from the meeting as well, and that's something that we've sat down and discussed as an operational staff team. This meeting matrix could change over time. In regards to our trends coming through and the advisory group sort of like requesting a bit more in certain areas. For example, I think mental health, some of the SEND work and the CAMS work as well. So it might be that we then deep dive into more operational meetings during that period of our work. So it really is it's sort of like a tangible document in regards to what are the requirements of us at that moment in time. But the key statutory one, Ben's, are actually only a couple. So it's your health and wellbeing board and the locality board as well. To me, and the health overview and scrutiny is a key one. So they're our top 3 meetings that we have to attend.
Yeah, brilliant. Thank you. Much appreciated. I think that's just probably for noting, isn't it? So we won't take a board vote on that. So on to the next item on the agenda. Sorry, because I wasn't expecting to chair it. I've got lots of things opened. Oh, so do forgive me. Right. Okay. So it is the advisory group report paper, and Katie, you're down for this again.
Yeah, sorry, I know it seems a bit like my talking shop. Staff are coming up with updates soon. So I'm going to take the paper as read, but some really key things that I want to highlight. So obviously our key areas of work which have come from the advisory group and the discussions at that level. With our menopause survey, which obviously the survey has been finalised, the report's been finalised, we've had response back on the report, and we are now working with the system to improve services in this area. Naomi's working with the Women's Network to look at creating a leaflet so that we can empower women with the local information. So really key piece of work. And what we're finding is that at the moment, our pieces of work are almost never ending a little bit. So, you know, there's always a little bit more that we can be doing. So we're finding that we're holding on to certain service areas of concerns for a little bit longer. Further information can be found there. But like I said, the advisory group really focusing us on some of these areas when they're coming up in our data analysis side of stuff. Next one was the pharmacy survey, and again, key issues found here. The report's gone into the system with recommendations, and we're just waiting for a formal response there. Key findings that we have found is that the minor ailment scheme isn't well advertised, and obviously with the cost of living crisis and deprivation across the borough, it's something that we really want to see highlighted to local residents and advertised. Another concern that's been raised around pharmacy is in regards to needle exchange. People are finding that they're left at home with loads of sharps, bins, and pharmacies and doctors' surgeries will not take them. So we did a bit of investigating, and actually we found that some pharmacies are commissioned to actually provide that service. So in the coming months, we're going to be going doing mystery shopping across the pharmacy patches within the borough, feeding in our intelligence locally and into the Greater Manchester system, and holding that individual pharmacy to account. So we've got a list of what the commissioned services are, and we're going in to see, you know, is that information readily available for residents? How do they know what they can do within that pharmacy setting? So really exciting piece of work. And again, the volunteers will lead on that mystery shopper side of that. And the advisory group are really going to lead in the planning of that piece of work. So participation groups, again, been around for quite a while in regards to our updates. So really massive impact in regards to this piece of work. We did a deep dive in October to find out where PPGs were at. In our findings, it was highlighted that, you know, PPGs aren't back up and running. And the local commissioners actually, on the back of our findings, did put it into place that all PPGs needed to be reinstated from the 1st of April. So really big impact. We've really been supporting our primary care networks in regards to the recruitment of PPG members. So Healthwatch Rochdale went out with a recruitment drive covering all GDPR type of things. And what we've done is we've recruited over 20 local residents to now filter back into their GPs to become participation group members. We're also looking at supporting the practices in the delivery of PPGs, trying to make them think out the box about how they can engage with the practice members, and it not being a complaints shop, but actually how can they be involved in the development of the service, and that's what it's for. So a really positive piece of work there, which is ongoing, and we're working with the system, and it's something that's really been well received from the system. Especially from the practice manager side. I've done some engaging with the practice managers at their professional forums to really highlight, you know, that we're there to support. We want that patient voice within the practice, and if we can do anything, and it's been really well received from them, because I think it is a bit of a grey area for them. Not only that, it normally sits with the practice managers, and actually, is that the right place for it to sit? There's loads of, you know, workers within the practice setting, and it's about understanding that skill set and training those individuals up to deliver. The local GP website reviews, so we've done 2 audits, all done by the advisory group members, and that all those findings have now been shared within the system. Really pleased, again, massive impact in this area. I've been on the primary care commissioning committee this morning, and it's been confirmed that for the Core Plus, which is the commissioning contractual arrangements for GPs, that the website has to be updated with our key findings. So massive impact in the fact that our work has actually pushed for this to be put onto the commissioning contracts for this year. So like I said, we're still working on the system with this, really keen to get patients involved and continue to keep patients involved in the development of local websites. But like I said, major impact in this area. Piece of hub engagement work. Again, this has been an ongoing piece of work for a couple of years now. Now sat with local authority. No recommendations have been made, but some really key information has been pulled out. And we're working with the system now to look at how our findings of that report can make impact to that local area. So I'm really looking forward to be able to update you in future meetings about how that is being delivered and how adult social care have taken our findings independently and turned them round. So we've got areas of outstanding practice and innovation. Something that was fed back to us from the system was around the negativity of our service, and unfortunately that's the beauty of the beast of what we do. However, we really reflected on that as an operational staff team and wanted to look at how we could, you know, turn a positive spin. We know there's good services out there, so we've done that by looking at Feedback Fridays and really looking for that positive experience, and we share that out there. Our entry review reports, you know, they're a really positive mechanism. They're not, we don't see the entry reviews as a negative, you know, focus. So we're really trying to look at how we can reflect on, you know, the negative feedback that comes back to us, but actually highlighting good services when they're being identified. So over the last 3 months, the advisory group have given over 40 volunteering hours. Really to highlight, you know, these are residents that give the time to the organisation because they have a passion about the service delivery of health and social care, and I can't thank them enough for that time that they give. And then finally, just to update you on the red flag issues. So obviously the theory of change we were due to do a bit of an engagement around cost of living, and that got pushed back after.
Okay, sorry, can I just interrupt? Sorry, I'm really sorry. Can you just briefly explain just what a red flag issue is, especially as we're on a live stream, if that's okay?
So a red flag issue for us as an organisation is things that where we know things are rumbling, we're receiving the data and we're hearing, you know, that information on the ground whilst we're engaging. So the key things for us that the advisory group are absolutely keeping their eye on, and we're constantly working and engaging with the system to get updates in these sort of areas. Sometimes, you know, unfortunately, it's not a quick fix with some of these issues, and some of these issues will remain on the red flag, you know, maybe all year, because things aren't happening, you know, things aren't changing overnight within the system. So that's what the red flag is. It's really just saying these are key areas that we're looking at and we're keeping an eye on. Further work's being done in some of them. Low-level escalations have been raised within the health and social care arena for others, but it's something that we will continue to report to the board on. Is that okay?
That's fine, thank you.
Flag issues around making complaints. So we've completed our interview now, and that's going to go on our website. But again, people are struggling and not understanding how they can raise concerns and complaints. Something that we've picked up. Primary care access is a massive issue, and that's not just GPs, that's dentistry and pharmacy. Dentistry comes down a bit further down on the list as well, just because we've had so much feedback on it over the last quarter. What we're finding is a lot of private dentists are actually, a lot of NHS dentists are writing to the patients and saying, you know, from the 31st of March, the letter was stating that they're no longer on the NHS, and if they want to remain with the practice, they need to move to a private patient. Unfortunately, we've fed this into the commissioners locally at, you know, Rochdale level and at Greater Manchester level, and it has been raised, but the contractual arrangements mean that there's nothing we can physically do about that. But it is you know, there's a lot of vulnerable people that aren't able to receive the care that they need at the moment around dentistry, and that is including children. So key area for us to keep an eye on. Needle exchange I've mentioned briefly, and again that pharmacy work and the fact that we're going to be doing mystery shoppers there. Another area around the needle exchange which we established was that you can actually take them to your local tips. And you know, they can be disposed of, but again that's not highly advertised because the tips don't want them, so it's a really difficult area. Number 5 on the list is Lancs UK. So for those that don't know, Lancs UK was a service that was delivered within the Rochdale Borough, specifically around ADH services, and it's an adult service, not children. CQC put restrictions in place back in, I think it was over 24 months ago now. Unfortunately, the service has now been pulled from the borough. So at the moment, there is no ADHD services, which means that there's a large population which are struggling with medication for ADHD because they were ongoing service users, but also a lot of people that are in a no man's land due to, you know, being confirmed as diagnosed, but then waiting for follow-up medication conversations. We've had reassurance from the system that this has been highlighted at Greater Manchester level, and at a Greater Manchester ICB level, they are looking at coming in to support the Rochdale Borough in regards to our waiting times here. Safeguarding issues have been raised around people's escalation with mental health concerns, and this is something that we are keeping a close eye on. It's discussed on a monthly basis at the Quality, Safety and Safeguarding meeting, and we continue to feed our trends analysis into this area. Another area of work is around our transitional social workers, and we've identified a gap in service here. So this is what we're finding is people have social workers as children, but as they hit a certain age, they move into adult services. And actually there's almost a gap in regards to that transitional time in regards to social worker support. So this has been flagged at various meetings, and it's actually our impact here is that it's been put on a work plan to follow up and review this area over the next 12 months. So again, really positive that our findings are actually being delivered on a work plan to follow up in this area. The last four that are on there were highlighted from locality report, which went into the system. So there's a massive local engagement requirement, and we've got some concerns locally about how that's going to be delivered, what with capacity across the sector, the changes across the communications and engagement at a local level. That's all moved up to Greater Manchester, majority of it now. So they've been raised, and we're waiting for a response on that. We've also, the transitional social workers are duplicate. Dentistry, again, we've raised that as a really key issue because we feel that there's a lot of people that aren't being able to access services at all. And you can only access the alternative service, which is an emergency, if it is emergency care that you need. So there's no consistency or continuous care around dentistry at the moment. And then GP out of hours, the concern here is around limited information and inconsistent messaging within the public domain. So there's been changes to extended services, you know, your weekend services at GPs, and the offer to be able to go to a different GP, a different hub. And we've got concerns that although it's a brilliant service that's offered, there's no communications out there, and we feel that GP receptionists and signposting patients when they can't get in at the practice in the mornings to the additional services. So they've all been raised. And then just to give you an update, coming up in quarter it's quarter one actually, coming up in May, we have got a development session with the advisory group, and it's really just a chance to take stock of the last 12 months, really focus on the excellent work that's been done there and look at how we want to move forward. And we've also got a new member, which I'm really pleased to invite to the group, so they're joining the meeting next week with us. Thank you.
Thanks, Kate. Any questions from the board?
Not a question. I'm just pleased that the work areas are all very relevant and current, and there's some really good work gone on there. So excellent report.
Excellent. Yeah, I concur. David, any comments? I'll take that as a no. All right, so that's just for noting. So we'll move on to the next item on the agenda. Kate, because of the circumstances we find ourselves in with the chair and looking down the agenda, there's nothing we need to do in terms of actually passing anything. The others are just for information and noting and asking questions, aren't they? So we don't need to rearrange the agenda in case I have to leave. Okay, thank you for noting that. So on to item 12, which is the Q4 update, and it's a presentation. So I think you're leading it, aren't you, Kate? Again, over to you.
The staff are on the call today, and I think it's Naomi up first. So I'll pass over to Naomi. Thank you.
Yes, I must say I do love that picture up front there of us all. Yeah, so thank you. So I'll give you a bit of an update from engagement. We have been really busy over this first quarter of the month, like this from January to now. And a lot of it has been massively helped and improved by having Judith on board as our community engagement project worker. She is really managing to get some inroads into organisations, different establishments, but also she's really raising the profile of Healthwatch Rochdale and also raising more awareness of the organisation. Over this first couple of months, we've done specifically on raising awareness. We've actually gone to 17 different group sessions, just mainly specifically to do that raising awareness. But whilst we're there as well, it's sort of like that dual purpose. We're gathering feedback at the same time, as well as trying to give information, advice and signposting. Some of these organisations who we've not really engaged with before, we went to a Rochdale jobs fair, and I'd probably say there were probably about 70% of the people who was at that jobs fair had never heard of Healthwatch Rochdale. So it were really good just to get that word out there and spread that awareness of the organisation. And from that job fair, we did actually get 12 people who signed up as an interest for volunteering. So it was really beneficial to be at that. So I have actually sent them details, just waiting on some to come back. From the back end of that, we have actually recruited one new advisory group member who shared details. So we've also been trying to, whilst we've been out and about, we have been doing a lot of trying to ensure that we gather more information as well from the menopause survey. So although we have like what we're classing as our phase 1 report, it was noted that we needed a little bit more representation or insight in it from ethnic minorities. So we are really focusing on trying to get more voices in from that demographic across the borough. We are absolutely chuffed to bits that we have finally now got our Quality in Action Award from Action Together. As you can see, very proudly holding this certificate here. It is on my desk, I won't lie. I take it out at every opportunity and show it to everybody who wants to listen to me. It took us a long time to get this just because of turnover of staff from Action Together and other gaps in things. But we are really proud to have this now. So we have got our certificate. It's an independent local seal of approval, as they call it, and it massively demonstrates us as a Health Watch, our commitment to quality assurance, and especially around volunteering opportunities. It's ensuring that we've got very good processes, compliance in place. It was a very long checklist of things that we needed to have in place. And also it's just been a really good bit of an overview for us as well to just update some things and look at some things what needed like a bit of a pizzazzle. So we are really pleased with that. They do recommend that you sort of like re-audit again, like in another 12 months, just to ensure like your policies, because they do have the dates on them, ensuring that things are still turning over and ticking over. But the support that we received from Action Together as well was absolutely fantastic. Laura, particularly, who's in the picture there, really did support us and help us along this process. And it was with their help as well that we developed our volunteer handbook, as well as our volunteer agreement. So we are really thankful as well. And our Youth Watch has been doing really good. I absolutely love this picture on here. This is a group from the Canagerie in Castleton, and it's a group of young women who meet every week. And the idea behind it is to empower young women, give them a voice, ensure that they do things, but also do it through like a creative way through arts and things. They are collecting the winter warmer packs that we supplied to them, and they were absolutely chuffed to bits with them. So within these winter warmer packs, there was we got a small grant for these. The Youth Watch members helped us sort of like decide what they wanted in these packs, and the idea was massively with the cost of living, how certain things could help these young people basically keep warm and keep well. So they had a quilt, they had a teddy bear quilt cover, they had Greggs vouchers, thermos flasks, hot chocolate, reusable bags, hot water bottles, hats, scarves and gloves, as well as Healthwatch branded pens and things in there as well. But the young girls at this group absolutely were thrilled to bits with them. So we're really thankful to Danny as well, who facilitates this group, who's allowed us to actually go in and give these out to the young girls. So that's what that picture is from. So Our aim of Youthwatch is to gather in, the voice of youth across all 5 boroughs of Rochdale on health and social care matters. Youth experiences are very different to adult experiences, so it's absolutely important that we do hear their views, and we're quite lucky in that the Youthwatch members we have are very vocal, and they're also very involved within their communities, within their schools, educational settings, and things that they do discuss, they do actually go back out, and even our monthly PowerPoint that we do for our meetings, they take it back into the forum rooms and stuff. So they are very proactive in what they're doing. We do continue to engage online, and that's been the preference from the young people. I've asked them, if they'd like to meet up more in person, and they do prefer it on Zoom. So we do still meet every month on Zoom. Again, we have topical conversations, we have themes, we do invite guest speakers in. The monthly meetings are very much driven by the young people. It's them who sort of like say, do you have any information on this? Can you get somebody who can talk to us about that? And it's, it does come from them, and sort of like feedback and conversations we have on who comes to our meetings. One of the most recent ones we did was a consultation around play zones in collaboration with Rochdale Football Club. So there is going to be, they're looking at some funding for play zones in the Rochdale Borough, but it was really interesting, some of the key conversations that Liz, who came along to talk to the young people, the concerns that the young people, especially the young girls, raised in the fact that they wouldn't like to go to, well, one, they didn't like the name of play zone, but also the fact that they didn't want to be going to play zones in the dark, in the evening. They were, they were concerned about whether these areas were well lit and things, and there were really valid points. So we have been promised that we will get further updates on the play zones as well, and how the young people's voice feeding into it has had an impact on that bid that they've put in for it. We're still offering our young people a £25 incentive if they come to 5 meetings, which has been working really, really well. And we have, I think, over the 2 years, I think it is, we've had 8 young people who have received that. We've sort of like narrowed down our recruitment pack just to make it a little bit easier for the young people to fill in them forms and join us. And we've been doing a lot of partnership working. We've been looking at who is out there, what groups are out there, mainly from the voluntary sector especially, but also we've made really good links with the Youth Parliament. The Northern Care Alliance, lived experience of school nurses as well have been key. We've been into Redwood School, and also we're looking at more partnership working with Rochdale Pride, which was Rochdale in Rainbows, working closer with our young people as well. Next slide, please, Kip. Training. So we have been really busy doing lots of different training. When we got our Freddie Award, there was not massive gaps, but there were like little bits of areas what people needed to improve on a little bit, or where we thought we needed a bit more knowledge so that it could help us with our engagement, help us with our, with our work projects. Between the staff, especially, we've done some LGBTQ, some training on the terminology and legislation around that, and working within the communities. We've done some equality, diversity, inclusion development. That was run by Healthwatch England, and it were quite a good, in-depth, intense training program. We've done, it was called Co-Production, Quiet and Silent Voices, and it was mainly around how you can engage within your core community groups and how you can better get their voices in, and especially gathering feedback in from them. Another training day that we did, and which were in person, which made it all the more exciting, was with Talk English Rochdale. Talk English deliver ESOL classes and sort of like they're a bit like sort of like citizenship type of things, with refugees, people seeking asylum, or people who have little or no English in the Rochdale Borough. They're a very well used service. They have a really big waiting list, but they ran some training basically around how to engage with seldom heard communities, and especially from the participants of the courses. Now, how the work they do links very closely with the work that we do, for example, and how we can better partnership with each other, and also how we can go into them sessions to raise awareness as a Healthwatch. I did a board development project with Healthwatch England over 8 weeks, and that were mainly around how to develop recruitment for your board, and looking at all the paperwork behind it. So that is one of the things that we are keen to be doing over the next couple of months, is going out for more board recruitment. We've internally done some training for enter and view reps, but Judith has also done the Healthwatch England enter and view training. And externally, we've done some training with local organisations around being carers champions, giving advice, living well. Have done some good help. Judith is now, additionally to myself, a first aid trainer, and we've also done active listening, peer support, and also some trauma informed training. And that's it in a nutshell. If anybody got any questions.
Are there going to be any more recruitment events that you said were so useful?
Yeah, so sort of like by making that link with the Rochdale job skills team, they've actually put us now on the distribution list for when they've got any events coming up, whether they're in the job centres, in the libraries, anything like that. And they've also told us that if we can't make the event, then they will share information for us. And also the Rochdale Working Skills team have offered to put our volunteer information within the monthly, I think it's monthly or bi-monthly bulletins what go out with volunteering opportunities as well. So it's been a really good partnership working that.
What about board recruitment at these events?
That's what we're going to be going out for, David. So when we finish developing our new package with using all that training that Healthwatch England have given us and the sort of like information they gave us on that, we're definitely going to be going out for board recruitment, specifically over the next couple of months. We're looking mainly as well to target during Volunteers Week, which is the 1st to the 7th of June. We're going to have a huge volunteer push in that week as well, and again specifically around increasing our board numbers.
Right.
Thank you. So it's Claire next, I think. Is it Claire? You're going to take us through information, communications. Thanks, Naomi. That was a really good update.
Sorry, I just need to expand this window because I made it small for the tweeting and now I can't see. Right, okay. There we go. So we basically Healthwatch Rochdale. So I deal with all the digital side, so the website, the social media. It's a primary focus of our communications. Is the digital side. So our website is currently being updated to Drupal 9. We was one of the first to transfer over from Healthwatch England. So it's a more attractive website, but it's not been without its problems. We've had a lot of problems with web forms not working, etc., but we've got over those blips in the road now. So I hope you've all had time to have a look at it, and I hope you agree that it is a much more attractive website. So I'm just going to go through what we've had on our website, but never mind, we're on the next slide. So recent information published onto the Healthwatch website. So we've just had all our policies and procedures updated on there. Previously, we didn't have those on there. Obviously, that's something that we needed to have on there. Yeah, just regarding Margaret, she has messaged me. She is struggling to get onto the meeting and said she's going to come on for part 2, Ben. So we've had information on the interim view. We've had our residents' reviews on there. We've had all our news on PPG, all our awards with Quality in Action. Everything that we send out to our mailing list is published on our website. We also have information and advice articles on there. We're looking at, I want to develop more advice and information on there, and patient stories to get a bit more of a personable feel. I think we've got all our reports on there. We've got all our news on there. It's fantastic for reporting on what we do, but I would like to just see a bit more, again, advice and information and personal stories. Next slide, please, Kate. So we've got our social media platforms. So we've got Twitter, Facebook, Instagram, and LinkedIn. They're all different platforms. They all have different audiences. LinkedIn is sort of very professional, job-based. That's where we post a lot of job opportunities, volunteer opportunities when we're looking for professionals. Again, Twitter, we have a lot of organisations who interact with us on there, and we do a lot of our partnership tweets on there. Facebook is more of our personable residents, engage with us on there, and Instagram is great for posting all our pictures when we're out and about. We had 4 press releases as well published in Rochdale Online last quarter, which was really good. So we had the Quality in Action Award published on there, our menopause report, our residents review, and our PPG report. Next slide, please, Kate. And as you all know, I'm the interim view lead. I did the previous programme prior to COVID, which we've just picked up again. So we've carried out 2 interim views, both at the infirmary, one at the outpatients department and one in the urgent treatment centre. They were both planned visits, so the hospital were aware that we was going to be attending, but they was given a 2-week time frame and told that the visit could take place anytime within those 2 weeks. It was really, really positive. They worked really, really well with us. They was really on board and really wanted to hear that patient experience and know how they could improve, and were really receptive to our recommendations. So the one on the outpatients, we received a response and an action plan, which has now been published in the public domain. It's on our website. It's been shared with Healthwatch England, with the CQC and local commissioners. The urgent treatment centre, we have just received a response today, a week early within the statutory time frame. Again, there is another action plan. So we will be getting that action plan into the report and publishing that into the public domain. We'll also be following up now on these action plans. So this is something that we didn't always have time to do in previous interim views, but we've got our impact tracker now. So we will be planning in doing a follow-up and seeing, that these actions have been completed, that they've said they're going to complete, and look at the difference that that's made on services so that we can track the difference that we've made. So from May, we're going to be recommencing our care home interim views, and we've got 9 planned for the year ahead. Thank you, Kate.
Thank you, Ben. The last slide from me. So just to give an overview in regards to what specific work's been done in Q4. So obviously we've been working with the council, which I've mentioned in, the advisory group update around the Alkinson Hub survey and engagement there. Our interim view programme at the Rochdale Infirmary. Actually, getting our documents back up to date. It's been a couple of years due to COVID since we've done them. So a lot of time in Q4 was making sure that we were ready to deliver on our interim views and refreshing around the training. Obviously, the GP website work has been key. Although all the work's been done in regards to the website development, there's been meetings that I've been attending to ensure that our findings are key in regards to the development of that website work at a local and a Greater Manchester level. We've been out for our annual 360 resident and stakeholder review, and the next agenda item today covers those reports. But really key in pushing that from an engagement perspective and me strategically with all the professionals that I work with. Again, the key piece of work which we've already spoke about is the refresh of our strategy, and the fact that we went out for engagement phase 2, and obviously the strategy has now been approved, and there's a bigger document to now create on the back of that. We've done some work with the CQC, with Healthwatch Oldham, and Healthwatch Oldham led on the work around maternity services and gathering feedback there, and that's due to be published, and there's going to be a launch event which Nye is heavily involved in mid-May. So really big piece of work that really key in regards to that partnership working, not just with the sector, but also, like I said, with Healthwatch Oldham as well. The Greater Manchester in Healthwatch is a massive development area. Obviously, as 10 health watches that cover the Greater Manchester footprint, we are constantly developing and working to really improve, how we can offer our services and standardise, that local health watch footprint across each place area. So myself and Margaret have been spending additional working hours, really, pushing the Greater Manchester network forward, specifically and around the funding that's now been confirmed at that Greater Manchester level into the Healthwatch network. So we're due to be going out to recruit posts at that Greater Manchester level and an independent chair. So there's real development there in order to, really function at that Greater Manchester level and be able to work at place as well as that GM function. And then the last part of Q4 was actually, a press release has gone out today. Our contract went out to tender, and I'm pleased to announce that we successfully won the contract again for a 3+2 time period. So over the last couple of months, it's really been about our operational planning in regards to what we said we would be delivering in our tender. And there's been some shift in regards to, obviously our statutory functions and our core deliverables don't change, but actually looking at how the systems change, thinking about how we operate, there's been some changes in the way that, we're going to be delivering our work. And a key area for us in developing specifically around social value. And really looking at what we're giving back to the Rochdale Borough around that social value element. So lots going on, and as we move into obviously the new financial year, it's really about starting to deliver on those operation planning and making sure that we've got our plans and our set up, and we're ready to get out and engage, and our information, advice and signposting and our communications are all planned. So it's been a really busy time, and now we're just finding our feet to sort of like start delivering that. I think that was the last slide. Yeah. Any questions on that? No. So just to know that Ben has now left the meeting. So there's only one more item left on the agenda, which I will continue on with, which is the 360 residents and stakeholder review report. Before I go on to that, did anyone have any questions in regards to that presentation?
Sorry, can I just echo that, just in regards to the interim view as well, it's been really nice for our volunteers to be involved in that as well. So I'd just like to thank them, because it's not, they're not a quick visit, they are a big chunk of their time. So I'd like to thank our volunteers as well as Claire for taking part in the interim views.
Yeah, thanks, Naomi. We couldn't do it without them.
Not at all. Yeah, thanks.
Thank you. So I'll take us on to the final agenda item, which is the 360 review findings. I'm just going to whiz over this as a presentation, just for transparency in regards to the public board meeting. So we've started to engage on the 360 review, and you can see here the key questions that we ask in regards to specific engagement. Healthwatch Rochdale publishes various forms of communication to highlight the impact the organisation is making. And then you've got strongly agree, disagree. So you can see from our findings there that majority of people strongly agree and agree, which is obviously good to see. There's an option to make comments on the back of all the questions. Some of the comments are quite interesting to read and unfortunately are out of our hands. So for example, they're saying that if we had more money from the system, we'd be able to deliver better in this area. Better awareness campaigns. So that's something that we're taking on board. By sorting out GP services, which is poor, needs improvement. So these are just comments that people have come through. So it's really looking at how we can engage and make those recommendations and reports into the system different as well. You said we did approach and put successes on posters. And I think some of these comments that have come through, we've got an action plan at the end of this presentation to show the board how we're going to look at changing so that we can, look at improving our residents review next year. And there, just to say that we had 42 responses, received this year. It was a drop from our responses last year. However, we do know our awareness as a whole has raised. So quite interesting that people chose not to get involved with our survey. So another area that we asked about was communications, information and advice, particularly about reliable information that we share. And like I said, as a whole, strongly agree has come out there. Healthwatch Rochdale and our website, easy to use. And again, you can see the findings there. And then we asked specifically about our social media. So some of the comments that came back about how we could be more effective in this area, I highlighted below. So just, make itself better known rather than obscure. So, it's what we're finding is a lot of the comments were really about pushing ourselves in regards to our comms. Now, our comms statistics are really strong, and as a Healthwatch, we're really strong in this area. So I think for me, it's about engaging with those people that don't know about us, that aren't, on our social media platforms, and that needs to be done on the ground. So in regards to impact and you know how residents review what impacts we make. So we asked Healthwatch Rochdale publish various forms of communications to highlight the impact the organisation makes. Again, people agree and strongly agree, but we know as an operational team that is definitely something that we can develop on and become stronger with. And not only that, what we've realised is sometimes we're almost chasing that impact straight away. And actually our work can be over a longer period of time to really bring out the positive impacts that we've made in regards to service delivery. So, you know, we're learning there as an operational team, as well as taking on board, you know, what residents are saying to us. And the second one there is saying about our reports and recommendations again, and understanding, you know, that we are making impact. And I think if you've had a chance to read over the end to review reports, especially the outpatients, you know, we made those recommendations. There's an 8-point action plan that's come off the back of that. We are making the impact. The system is listening to us and acting upon what, you know, what we're finding, whether that be through our end-to-end views or through talking on the ground with residents. So some comments that were made there is I've never seen anything specific. So I think that's something that we really need to highlight. You know, you said, we did, and this is what impact's made. So that's something that we've discussed as a comms. Couldn't tell you how you have made impact. So what we found from the comments that were here was that actually people couldn't find that. And I think what we've realised is that's because of our impact is almost recognised in our reports individually. And I think it's about how we pull that out to really highlight our impact on a monthly basis. And that's something that we're working on as an operational team. So who responded to our survey in regards to demographics? So 63% of the respondents were female, 69% were heterosexual, 80% of respondents were British. So that's a really key area for us that, you know, we've discussed operationally about. We need to see our demographics changing slightly. We need to see less white, you know, less high white British response rates. And we need to do that through raising awareness of the organisation with our minority groups. So hence the seldom heard engagement plan and really getting into those grassroots there. So we heard from all ages from 13 years old to 80 plus. And 90% of our respondents were aged 25 to 64. Then just a few more around 12% consider themselves to be a carer, 11% to have a disability, and 12% considered to have a long-term condition. So our action plan on the back of our findings, and this is a document that will be brought back to board on a quarterly basis to provide an update. You know, this isn't just a exercise of going out for a 360 review. We really want to improve and make sure that we can see those improvements year on year in regards to, you know, the findings of these surveys. So our action plan in regards to residents, we're looking at creating communication campaigns which highlights our role and identifies our statutory powers. We are quite complex as an organisation, and I think it's just really breaking that down into layman's to understand, you know, what, and hopefully our new vision and our new strategy and our, you know, mission values, they will all come as part of that in updating them of what we do. Raise awareness of our branding and distribute leaflets across the Rochdale Borough. Create posters and put them into, you know, key identified areas. Posters have been a bit difficult, sort of things people didn't want leaflets, they didn't want posters about because during the COVID time. Now they're allowing it a little bit more with a few more health and safety tweaks, but you know, we can start getting our merchandise back on the ground, so that's going to be key, you know, to make sure we're doing that from an engagement perspective. Wider grassroots gathering to gather more increased feedback from our minority groups. And then create our quarter impact reports. So that's something that we're going to be reporting on a regular basis. So moving on to the 360 stakeholder review, we had 17 responses this year compared to last year. But a little bit disappointed with, sorry, let me go back. A little bit disappointed in regards to the number of responses this year. Like I said, we're absolutely everywhere in regards to stakeholders, and this went out from a professional perspective to a really large mailing list. I put it down to everyone being busy, I'm hoping, but the findings that these are the organisations that did respond, and oh sorry, bear with me. I'm going the wrong way. So these are the organisations that did respond, and these were the questions which were asked overall. So I'm aware of the statutory role. I'm not going to go through them all. I know you're to contact Healthwatch. So it was really about seeing if professionals knew how to contact us, what we did and what impact we made. Now, as a whole, you know, people as a whole, the response rate was quite high around strongly agree and agree. We are aware that some professionals don't know about us, and we're really keen to work with services, and there's been an offer, which there was last year, for example, with adult social care, to go into their team meetings, raise awareness, but also let them know about our volunteering opportunities if the Rochdale residents. So that's something that we're really keen to do. So I'm not going to go into too much detail there. So we asked what the barriers were in regard from the stakeholders, and these are just some key comments that I pulled up. So the council needs to engage and work with partners like Healthwatch more instead of seeing them as a barrier or blocker. The patient experience information should help inform decision making and where resources are allocated. So some really positive comments coming from the system to say, they want to work in partnership with us more, but sometimes the blockers are in the system. We are finding that with the integrated changes around how health and social care is being delivered locally, those boundaries are dropping a little bit more. It's a little bit disappointing when we read some of the comments around Healthwatch does not communicate with adult social care as a whole. We run the Together Rochdale communication group, which Rochdale Borough Council and NHS locally sit on and participate on, and all anything that's sent out is shared with the council comms team. So it's a little bit disappointing that information isn't being distributed across the council wider, and it's the expectations on us. But I think one key thing is about that relationship building with the communications team at Rochdale Council, and to make sure that it is a two-way process around sharing information. So just really wanted to highlight that. In regards to the action plan with the professional side of things, so we want to look at a professional leaflet for local partners with contact information, but also to really identify what it is we do. Sometimes, we can see an influx in regards to people coming into the organisation, but it can be inappropriate signposting, people thinking that we can do, various things that's not within our remit. So it's really about giving that information to the professionals to ensure that the service user is being signposted to the right place straight away. Attend local team meetings, like I said, and that's something that we really want to do, but it doesn't often get taken up, which is a little bit unfortunate. Share key decision-making documents and procedures with local partners and stakeholders. So for me, that's looking at what's on our website and how we can promote our website with the local professionals, and signpost them to our website for additional information about us as a service. We're looking at a stakeholder event. It won't be April, sorry, that's a typo. To give an update on our work, and also Welcome Wednesday. We're going to recreate the Welcome Wednesday there. And then better demographic reporting through our impact reporting. And that's really to highlight to the system where we are engaging. That's something that came out through the comments, that sometimes they can't quite see that seldom heard voice, and and those groups that often don't get heard coming through our reporting, and we are out in those areas, so it's just really about how we report on that. So that is everything in regards to the 360, and like I said, there'll be a follow-up in regards to our action plan to reassure board and obviously in the public domain about how we're hoping to fulfil those actions over the next 12 months. Any questions on that?
No. The same questions used for the public year on year? No. So it used to be a lot larger document. So we checked. So the same have been used as last year, but we did change them up sort of last year because it was heavy. So yeah, we've used the same this year as we did last year. As a whole, the response rates are very similar. But that tells me that maybe it's the same people responding on those surveys, and that's what we need to try and improve on, getting that broader spectrum of Rochdale residents' voice on, on our delivery stuff. I just meant so that you could compare to previous years if the same questions are asked. But also, as you just said, the number of respondents is quite low at 44.
Yeah, it's disappointing. We normally get a lot higher response.
I think some comments that we got as well, though, wasn't it, that some residents found it quite heavy going, like quite a long survey, and I think that's something we need to bear in mind next year, like making sure we capture all the data that we want, but that it's nice and easy for people to just go boom, boom, boom.
Yeah, and I think asking the residents, do you understand? Do you know what our statutory functions are? Do they know what is a statutory function? That's our terminology. So I think we need to think about how we're putting things across. What's impact? Well, what does impact mean to the residents? It can mean different things. So I think we need to focus on our wording and making that a little bit more accessible in the delivery, especially from a resident's perspective. Yeah.
You talk to me things like, have you heard of Healthwatch? Yes, no.
Yeah.
Do you know how to contact Healthwatch? Yes, no. Etc.
Yeah, but there's a lot of documentation out there from a Healthwatch England perspective so this is sort of like a best practice document. So this is like it's been used, and we tweaked it for Healthwatch Rochdale specifically. So it's really hard sometimes when you're shown best practice, but then actually we know we need to scale it back a bit. So next year is definitely the time to do that.
Yeah.
Sorry, can I come in there with Kate as well? So we are going to do a flash day in June, aren't we, where we are literally going to go into the borough as well and literally just ask that question, David, and said, have you ever heard of Healthwatch Rochdale? Yes or no, and sort of like look at that and then revisit it again. And we're going to, armed with all our flyers and information as well. So it will be interesting to see it, like we're going to target key areas, tram stop, train station, bus station as well. And, just ask residents on the ground face to face. That's a very simple question.
All right.
Thank you very much. So that's the last agenda item. Just to take it to any other business, if anyone's got anything they want to bring up.
No.
Then I will bring a close to the meeting. Thank you very much for attending, and David and Mel, if we can come back for 2:30 to do part 2.
3:30, yeah.
Yeah.
Okay.
Okay.
Thank you.
Thank you.